Identifying different methods of ventilator settings. That is our today's topic. But, before going to settings of the ventilator, we need to identify what is a ventilator and the process of ventilation. Ventilation is the process, exchange of air between the lungs and the atmosphere, so that oxygen can be exchanged for carbon dioxide in the alveoli. To deliver ventilation to a patient who is physically unable to breathe, or present with breathing insufficiency, ventilator is needed. A ventilator is a machine that provides mechanical ventilation by moving breathable air in and out of the lungs. In these pandemic days, ventilators being the most useful medical equipment for the patients present with COVID pneumonia. Ventilator settings. To give a brief definition, ventilator settings are the controls on a mechanical ventilator that can be set or adjusted in order to determine the amount of support for breathing that is delivered to the patient. Support can be provided in the form of ventilation and oxygenation. You must develop an understanding of how each setting can be adjusted in order to provide more or less of each type of support for the patient. The good news is, that is exactly what we're going to cover in this video. First, we want to identify the unit of the patient. Nasogastric tube goes through the patient's nose to the stomach. This is used to feed the patient while he or she able to start feeding by mouth. Endotracheal tube goes through the mouth to the windpipe or trachea. This makes a firm and sealed connection between the respiratory system and the ventilator. Mechanical ventilator blows air or air with oxygen through tubes into the patient's airways. Air flowing to the patient passes through a humidifier which warms and moistens the air. And finally a tube for exhaled air away. Identifying ventilator screen. The respiratory rate set by the user. This is the mandatory rate which the machine will deliver regardless of what the patient does. This is in breaths per minute. The tidal volume per breath. This is volume-controlled ventilation, so this is the volume of air the patient will get with each breath. They will get that 20 times per minute with this setup. Flow. How fast is the breath delivered by the ventilator? Waveform. This is a triangled waveform, which means that the air is delivered is not at a constant pressure throughout inspiration. Oxygen concentration is a percentage. In this example it is 45%. Trigger variables. Sometimes the patient may make some effort to breathe. This is just one of the ways another breath can be triggered. In this example, if the patient generates a flow of 2 liters per minute, then the ventilator will deliver another breath of 500 milliliters. Examples of the basic ventilator settings. Mode, tidal volume, frequency, rate, FiO2, flow rate, inspiration to expiration ratio, sensitivity, positive end expiratory pressure, alarms. In here we are able to describe the different modes of the ventilator. Ventilator mode. A ventilator mode is a way of describing how the mechanical ventilator assists a patient with inspiration. The characteristics of a particular mode control how the ventilator functions. Common modes of mechanical ventilation include assist, control, AC, synchronous intermittent mandatory ventilation, SIMV, pressure support ventilation, PSV, continuous positive airway pressure, CPAP, volume support, VS, control mode ventilation, CMV, airway pressure release ventilation, APRV, mandatory minute ventilation, MMV, inverse ratio ventilation, IRV, high frequency oscillatory ventilation, HFOV. Now we are going to describe one by one. Assist control mode. Assist control, or AC, is a term used to describe the number of breaths a patient is receiving from the breathing machine, ventilator. AC refers to a specific method for giving the patient mechanical breaths. An AC of 14 means that the patient's breathing is fully supported. Synchronized intermittent mandatory ventilation, SIMV, is a type of volume control mode of ventilation. With this mode, the ventilator will deliver a mandatory, set, number of breaths with a set volume while at the same time allowing spontaneous breaths. Pressure support ventilation, also known as pressure support, is a spontaneous mode of ventilation. The patient initiates every breath and the ventilator delivers support with the preset pressure value. With support from the ventilator, the patient also regulates his own respiratory rate and tidal volume. Continuous positive airway pressure, CPAP, is one of two cardinal modes of non-invasive ventilation. Bi-level positive airway pressure, or BPAP, is the other. As the name suggests, CPAP provides continuous pressure throughout the respiratory cycle. When a patient on CPAP breathes in, the ventilator machine will provide one constant pressure during the inspiration. When the patient then breathes out, the ventilator will continue that inward pressure during the entire expiration. CPAP is commonly used for patients with the following respiratory disorders: acute pulmonary edema, obstructive sleep apnea, obesity hypoventilation syndrome, Pickwickian syndrome. Volume support ventilation, VS. In volume support ventilation, the patient triggers every breath, controlling his own respiratory frequency and inspiratory time. The pressure support is automatically adjusted up or down according to the patient's lung compliance or the resistance to deliver tidal volume. This volume support mode, considered as a self-weaning mode, cannot be used patients who lack spontaneous breathing effort. Controlled mode ventilation or continuous mandatory ventilation, CMV, is a mode of mechanical ventilation in which breaths are delivered based on set variables. Still used in the operating room. In previous nomenclature, CMV referred to controlled mechanical ventilation, control mode ventilation. A mode of ventilation characterized by a ventilator that makes no effort to sense patient breathing effort. Airway pressure release ventilation, APRV, is a pressure-controlled mode of ventilation that delivers an almost continuous positive pressure with intermittent, time-cycled, short releases at a lower pressure. Spontaneous ventilation is encouraged, and the relatively increased mean airway pressures allow open lung ventilation. APRV was first described in 1987 by Stock and colleagues, who demonstrated that arterial oxygenation and carbon dioxide clearance. Mandatory minute ventilation was the forerunner of more modern, automatic methods designed to change the device's performance to achieve a specific clinical goal. MMV guarantees certain minute ventilation, regardless of whether the patient is trying to breathe. Inverse ratio ventilation IRV. is an alternative strategy for mechanical ventilation that reverses the classical inspiratory-expiratory scheme. This is achieved by modifying the inspiratory to expiratory ratio, typically with the intention to increase oxygenation by increasing the mean airway pressure, MAP. High-frequency oscillatory ventilation, HFOV, is a rescue maneuver for failed conventional mechanical ventilation.